Why was my VA disability claim denied without a C&P examination? Veterans are so upset when they file a disability claim and several months later they receive a denial saying your disability is not service connected, and they were not even provided a compensation and pension evaluation. And the number one reason for this is lack of medical evidence. Almost 100% of the time, in my experience, when veterans are denied without a C&P examination, it's because they did not provide the VA with adequate evidence to show that their claim is well-grounded. A well-grounded claim shows that you have a current chronic disability that causes a loss of function, that affects your life in some way, and that it is plausibly linked to your active duty military service. If the veteran doesn't provide evidence to support those two things, the VA is not even obligated to even consider your claim. You don't trigger that duty to assist that obligates the VA to provide a compensation and pension examination and to seek a professional medical opinion, an expert medical opinion on whether or not your current chronic condition is linked to your active duty military service. So if you receive a denial letter that says the evidence of record fails to show that this disability has been clinically diagnosed, you just found the number one reason for vets being denied disability benefits that they truly medically deserve. Many veterans don't go to the doctor. If they do go to the doctor, sometimes they're treated outside the VA medical system and they don't provide private treatment records of their diagnosis, or they are treated at the VA medical center and they go and they get evaluated, diagnosed, and treated. Treatment doesn't really work. They take over-the-counter medications, they self-treat, they don't go back to the doctor for several years, and then they file a disability claim. And they might receive a disability denial letter that basically says there's no evidence to show that you continue to have a disability. The medical evidence of record shows that your condition has resolved. Well, your condition may not have resolved, but if it hasn't, show medical evidence, provide the VA with medical evidence that you still suffer that condition. It can be lay evidence. You can provide a lay statement, showing that you continue to suffer symptoms, but you have to show some medical evidence that you continue to have a chronic disability. It has to be chronic. You can't have a condition that resolves and then file a disability claim, because you're not going to be provided disability benefits when you don't in fact have a disability. So the number two reason why disability benefits are denied without a C&P examination is that you don't show a plausible link to your active duty military service. A perfect example, a veteran files a sleep apnea claim several years after getting out of the military. They file it direct. They file it as if they had that condition on active duty. They may feel like they had trouble sleeping on active duty, and they may think that they had sleep apnea while they were on active duty. But if there's no evidence in your service treatment records of sleep apnea, some symptoms of sleep apnea, or diagnosis in a sleep study on active duty, that is not going to be won on a direct basis. You have to show some medical evidence that you suffered symptoms or had a diagnosis with a sleep study on active duty to win that direct. More frequently, veterans are service connected for a mental health condition, or they're service connected for musculoskeletal conditions that limit activity, and they gain weight, and weight gain is the number one cause of sleep apnea. So the medical evidence in that case actually supports service connection on a secondary basis. So veterans that file a direct claim for a condition that really should be claimed as a secondary condition may not even be provided a compensation and pension examination. Another example of no C&P exam is you file a presumptive condition secondary to exposure, but you don't show any evidence of exposure. So if you're a Gulf War veteran, for example, you were exposed to burn pits, you developed some chronic respiratory condition, and you claim, that chronic respiratory condition secondary to burn pit exposure, but there's no evidence that you were exposed to burn pits. You have to provide some evidence, either a statement, a buddy statement who was there with you and also exposed, that can attest that you were exposed to burn pits, something. You have to show some evidence that you were exposed. Another example are the 1-year presumptives. The big ones are hypertension, diabetes, and arthritis. 3 conditions, chronic conditions, that if you develop those conditions within a year of getting out of service, you are automatically eligible on a presumptive basis for service connection for those disabilities. If you have symptoms of those conditions and you eventually are diagnosed, if you're diagnosed after that year period and you don't show evidence that you had symptoms of that condition within that 1 year period, you may not even receive a C&P examination. If you were diagnosed or treated outside of the VA medical system within a year and you don't provide those records, again, you may not even be provided a C&P examination. Another reason why veterans may not receive a C&P examination is they file a trauma-related mental health condition, but they don't show any evidence of the stressor when the stressor occurred. There's no stressor verification. If the VA can't determine that the stressor actually happened, they may not even provide a mental health C&P examination. So provide the VA with evidence that the stressor occurred, whether it be corroboration. MST, military sexual trauma, is a very common example. Very frequently not reported. So many reasons why veterans do not report sexual trauma, but show some evidence, either a veteran or a friend that you confided in that can make a statement that that event occurred, some marker, some change in your military career suddenly, sudden drop in performance, sudden behavioral problems, sudden change in your military career. You were on a track for something and suddenly you got the heck out of there and pursued something else, or requested a change of assignment, trying to get away from somebody. Those are all markers that you should provide evidence for to support that the stressor occurred. At VetComp and Penn Medical Consulting, we specialize in helping veterans develop the best medical evidence to prevent the VA from not taking your claim seriously and not fully evaluating your claim with a C&P examination. So if you have trouble getting the VA to take your claim seriously, we may be able to help. Look us up at VetComp and Penn Medical Consulting. Thank you for listening.
The information contained in this video is informational and not professional advice. Rely on it at your own risk and see a qualified medical or other professional to discuss individual circumstances.